Like I was like, I'm also interested in kind of medicine overall. Like one nice analogy I like is that when a plane crashes, the FAA like gets that black box and they study it and they find like, how do we prevent this from ever happening again? There's systematic changes that, or like something happens that, new procedure, whatever, that they prevent future plane crashes. Whereas in medicine, it's almost like the plane is crashing and our goal is to prolong the crash. Like instead of like falling to your death in 8 minutes, you're going to fall to your death in 12 minutes. It's like we're just like, you have diabetes and now we're going to put you on all these medications. It's like your quality of life won't be like, why didn't we put that same patient on medication before they cross some invisible line that we decided is the definition of diabetes? Why didn't we? So that's really the big shift in medicine now that I think is happening largely with the younger people, is they're more preventative and they're really prioritizing their health and going to places like Hormones and Wellness by SC Botox and like, and it's the simple stuff too. It's literally like, the things that everyone talks about, like exercise, daily movement, whatever it may be, like you can geek out on different zones and, like heart rate, all that kind of stuff, but just moving, eating right, not drinking too much, prioritizing sleep, and then there's things like just going outside, getting early morning sun, like being in nature, feeling connected socially to other people. I mean, these things are all basically free, and it's just a matter of doing them so that you don't turn your plane crash from 8 minutes to 12. You're preventing those diabetes, metabolic disease, cardiovascular disease, dementia, like all the big cancer, all the things that kill people. So it's really, it's a beautiful thing to watch as a doctor, kind of like almost like society's maturation and prioritizing health and not having a car full of garages, but having like, a resting heart rate of 50. It's a real flex.
Right. The way that the FAA has been able to make flights safer and safer, right? And it's safer than driving a car, right? And how many flights have they been able to do, right? Compared to how many people have died or had got into accidents, right?
Right.
And that systemic improvement hasn't happened in health, right? There's actually a general from I don't know if it's the Army or the Navy, but basically talking about that, throughout the years, less and less people are qualified just to apply to the military, right? Because they don't have the basic, they cannot do the basic training because they have the minimum, right? They're overweight, they are, they don't exercise, right? And they cannot pass the minimum, right? So, and that's the critique that I have for the healthcare insurance. It's, you broke the car, well, we figure out how much it costs to fix it, right? But there is no incentive for prevention, right? In that
Exactly.
system.
Oh,
Right.